Bismillah ar-Rahman ar-Rahim. Thank you for joining us. I'm Dr. Abdul Qawi Mansari, consultant endocrinologist, and in the next 5 minutes I will talk about something really very important in these days, which is the relation of diabetes to COVID-19 or novel coronavirus. Before that, let me tell you this. Today is March 21st, 2020, and the story started less than 3 months ago in December 7, where the first confirmed case of coronavirus, novel coronavirus, which was later called COVID-19, was discovered in Wuhan city in China. By January 30, 2020, WHO declared global public health emergency. By January 30, 2020, WHO declared this global public health emergency. By March 11, 2020, WHO declared the outbreak as a pandemic. Now, as you can see here, by yesterday, more than 200,000 patients had coronavirus or novel coronavirus, and nearly 9,000 deaths, and this affected 168 countries in the world. As you can see, there is no continent which is spared from novel COVID-19. The first study, which was published in Lancet, which followed 41 patients who were admitted, showed some really very useful information. Now, average of 5 to 6 days, which is the incubation period, range from 1 to 14 days. After 4 days, the onset of the symptoms appear, and then usually about 40% will require intensive care unit admission, usually after about 11 days, okay? With acute respiratory syndrome, most of them required ventilation, mechanical ventilation. So the question is, what is the relation of diabetes to newly COVID-19? Actually, diabetes did not increase the number of, diabetes did not increase the likelihood of infection. Only 10% of COVID-19 patients were diabetic according to these different studies. But on the other hand, the severity of the disease was much higher in diabetic compared to non-diabetic. So as you can see here, in severe, there were about 16% diabetic compared to non-severe, which is 5.7%. And mortality also was higher in diabetic compared to non-diabetic, which is about 7% compared to 0.9%. So yes, diabetes increased the mortality and increased the severity of the disease. Now, how to manage diabetic patients? Actually, there is no enough data to suggest what to do, but usually, of course, we need to improve the blood glucose and prevent hypoglycemia, hyperglycemia, and prevent fluctuation. We need to remember that during acute stress like infection, the life will be interrupted, so there will be no regular diet, no regular exercises. There will be increase in glucocorticoids in the body because of the stress and the fear, increased cytokines, and also there might be a need for glucocorticoids, which will further increase the blood glucose. Now, how to manage diabetes during COVID-19 infection? We had, of course, we need to divide the patients as mild, moderate, and severe. In the mild case of COVID-19, there is no need to admit the patients usually, and we can continue the diabetic medication as it is, but we need frequent checkup of the blood glucose to make it within target. While in the moderate case, we may need to adjust and change the oral hypoglycemic to basal bolus insulin, and also change the mixed insulin again to basal bolus insulin to prevent hypo and hyperglycemia and fluctuation. In severe cases, the best case for diabetic patients, of course, is continuous IV insulin infusion, as usual anyway. So in summary, diabetes may not increase the risk of COVID-19. It's only 10% of COVID-19 were diabetic, but it increases significantly the mortality, which is 7.3 compared to 0.9 in non-diabetic, and also increases the severity of the disease. And in these cases, glucose monitoring is really very important to prevent hypoglycemia, hyperglycemia, and glucose fluctuations. Thank you.